New executive orders on the coronavirus look to protect some of North Carolina's most vulnerable residents. From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Thursday, April 9th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. The upswing of coronavirus cases at nursing homes across the state continues to be a big problem, with several locations reporting multiple cases within their homes. Dr. Mandy Cohen, Secretary of the State Department of Health and Human Services, said outbreaks have been reported at 21 congregate living facilities statewide, 18 of which are nursing homes. In response, Governor Cooper has signed an executive order spelling out new restrictions on nursing homes and other long-term care facilities to help limit the spread of the virus. Under the order, staff members are required to wear masks at all times. Residents and staff will be screened daily for potential COVID-19 symptoms, common areas are closed, and the movement of non-essential personnel is restricted. And finally, infected residents must be moved to a separate part of each facility, where they will be cared for by staff who only work with infected residents. At a press conference yesterday, Dr. Cohen thanked care center workers for their role in serving a particularly vulnerable group of people.
What you do is so important. You are on the front lines combating the spread of this virus, and we thank you. We thank you for your hard work.
Governor Cooper has also signed another wide-ranging executive order temporarily waiving restrictions on hospitals and other medical facilities as they plan for a surge in COVID-19 patients. The order also waives regulations on child care facilities in an effort to reopen enough of them to care for children of essential workers, gives healthcare workers expanded immunity from lawsuits, and opens a door to putting more medical students and volunteers to work on the front lines of the pandemic. In all, the order aims to boost hospital capacity while making it easier for medical professionals to access and treat patients. At the time of recording, more than 3,600 people in North Carolina have tested positive for COVID-19, and at least 73 have died. There are also 190 confirmed cases of recovery from the virus at this time. If you need to get your car inspected but are worried about doing so during the pandemic, don't. Today, North Carolina Speaker of the House Tim Moore and Senate President Pro Tem Phil Berger put out a statement promising that the General Assembly will, quote, retroactively extend vehicle inspection deadlines, end quote. They also noted that the State Highway Patrol is not prioritizing enforcement of out-of-date inspections. From WREL TechWire, as demand for telemedicine surges during the ongoing coronavirus pandemic, the North Carolina Medical Society is teaming with Wilmington startup Greenlight Ventures on a solution for healthcare providers. Together, they've launched a platform called Presence, which is designed to help physicians deal with the challenge of providing patient care where there are shelter-in-place orders in effect. The platform provides an online portal where patients can schedule a telemedicine visit with their provider, allowing them to connect to doctors and nurses remotely to increase physical distance and reduce contact. Presence is being made available free of charge for distribution by medical societies and health systems through June 30th. Yesterday, the North Carolina Department of Health and Human Services announced phone hotlines to provide mental health support to North Carolinians throughout the coronavirus crisis. The Hope for NC helpline connects North Carolina residents to resources that help them cope and build resilience during times of crisis. The helpline has served thousands of North Carolinians after hurricanes and is available 24 hours per day, 7 days a week, to everyone across the state during the coronavirus crisis. The number is 1-855-587-3463. Meanwhile, healthcare professionals, emergency medical specialists, first responders, and others who work in healthcare settings can get specialized support from the Hope for Healers hotline, a new initiative in partnership with the North Carolina Psychological Foundation. Hope for Healers is also available 24 hours a day, 7 days a week, and those who call will be contacted by a licensed mental health professional for follow-up. The Hope for Healers number is 919-226-2002. This has been your Coronavirus North Carolina News Brief for Thursday, April 9th, 2020. Remember, if you like the information you get from this podcast, let us know by giving us a rating and a review on whatever podcast app you use. And while you're there, be sure to subscribe so you don't miss our new episodes posted daily by 5 p.m. Thanks for listening.